Low tech or no tech? No, that's not a good phrase. So inflammation part 2, just to cover what I might have missed, the leukocytes, I made a little post-it note. The leukocytes, your neutrophils are going to be more present in the acute inflammation, and that's your short term, like hours, maybe days. Long term can be like months, years. So macrophages are going to be more in your chronic inflammations. And then we also have your lymphocytes, so your T and B cells, those will be in your chronic inflammation. Plasma cells and eosinophils and mast cells, because they release histamine, which if you've ever had allergies, you've had histamine released. Triggers can be infections, a physical one, so it was saying like even frostbite and trauma can trigger inflammation. Chemical triggers, so pollutants, if you have a pollen allergy. Yeah, so pollutants and also like environmental, like pollen. And then your immuno, which is your allergies, and tissue necrosis. So when your tissues die and it's not planned, then you're gonna have inflammation. So that's just the recap. And on today's episode, we're gonna run through this real quick because I'm late for something, but I wanted to finish this. So we have steps of leukocyte recruitment to the inflammation site. So this one you can kind of think about like roller skating. First, you're gonna have the margination, which is like you're slowing down because you don't really know how to roller skate and you're trying to get off this rink. So you're slowing down, you're kind of on the edge, and then you're gonna have rolling. So you're like grabbing onto the side to like stay standing because you don't know how to stop on your roller skates. And then you're gonna have firm adhesion. So you're stopped, you're holding on, and you're binding to these integrins which go between your cells, and they're kind of like handholds. So after you've got your margination, you're on the edge, you're rolling because you're slowing down, and your adhesion, you stopped. Now you got to get off the rink. So this is where your diapedesis, which is also transmigration, is, and that's you getting off the rink. That's like squeezing between the endothelial cells through this thing called PCAM. It sounds like pecan the nut, but it's with an M at the end. So PCAM1 is going to help you squeeze between. It's also known as CD31 because everything likes to have secret identities in biology for some reason. So last step is chemotaxis, which sounds like chemo, chemical, taxis, movement. So your leukocytes are going to go towards the injury, like where your injury is, be guided by the chemical, like these are the little flags. So you got off the ice or the roller skating rink, whichever skating it is, and you see the little food stalls and you want to go there, that's going to be your chemotaxis, chemical things that are flagging you down. So that's C5a, IL-8, LTB4, and bacterial products. Your leukocyte activation and phagocytosis. So leukocytes, you're activated when they encounter the microbes. And then phagocytosis is, remember, like cells eating cells. So that's going to be, it's going to recognize a cell because it's been opsonized, which is coated in something that makes it look attractive and recognizable. So that's usually, C3b and IgG are your common opsonization agents. And then it's going to be engulfed by the phagolysosome. And then it's killed and expelled. Mediators of inflammation. Those are your histamine, your bradykinin, and leukotrienes. So those all increase your vascular permeability. You also have vasodilation, so your veins dilate. They get bigger. Constrictions get smaller, dilations get bigger. so a lot more movement is going on. Bradykinin is your major indicator of pain, and if you have a fever, you're gonna have IL-1 and TNF. IL-1, anything inflammation, just think IL-1. That's your issue, or like that's what's signaling all these things happening. And you also have like a little bit of histamine for things, but it's not as prominent. You really want like your IL-1s, your TNFs, maybe your IL-6. Outcomes of inflammation, it either can get better, so you're back and healthy. You can have a scar formation, like if you had a cut and it wasn't able to bridge it properly and like rejuvenate the cells as fast as needed, then you'll get your fibrous tissue of your scars. And that's like if there's substantial tissue destruction. Chronic inflammation, because it could be a chronic issue, or sometimes abscesses. Super fun. Roles of them, you got your blood cells, already covered. The different types for neutrophils and macrophages. And this was supposed to be fast. It's taking even longer than the other video. Okay. So examples for acute inflammation and then chronic. So acute is like appendicitis. A chronic would be like rheumatoid arthritis. Another example of acute could be an asthma attack. Another example of chronic is like Crohn's disease, or chronic viral hepatitis. So systemic effects, we covered IL-1. Morphologic patterns. So this is going to talk about the different types of inflammation. So we have the serous, which is usually serous fluid, pretty watery. Fibrinous is going to be fibrin rich, which is in the name. Suppurative, which is also known as purulent. Anytime it's purulent, you will have pus, which is neutrophils and necrotic debris. So like the dead parts that you want to get rid of. You could get ulcers or granulomatous inflammation. So that kind of goes back to your caseating and non-caseating granulomas. It has to do with the cell death, and I can't remember exact details right now, but there are some disease examples. It's not covered in this, but that was just bonus knowledge. All right.